State employees say they are being forced to work in filth after repeated flooding and sewage leaks inside a state hospital.
KIRO 7's Amy Clancy talked to one woman who broke down in tears, sharing her frustration about a facility with a long history of problems.
Feces, human feces falling from the ceiling.
This hospital employee asked that we hide her identity, fearing retaliation for speaking out.
It's never been this bad.
She doesn't hold back describing what she says is happening at Western State Hospital. KIRO 7 obtained photos from inside Building 19 on the hospital's Lakewood campus, where the basement offices suffered a major sewage flood in April.
Nobody could go in there.
It appears the initial flooding happened when patients stuffed something in the toilets 2 floors up.
We have a problem with the pipes, and instead of fixing the pipes, they just kind of patch it up. But we've had ongoing floods for years in that department.
Sewage floods?
Sewage floods.
So this wasn't the first one?
No, no, no.
You can see what employees are dealing with. Liquid all over the floor, portions of the ceiling falling apart, and boxes of files covered in plastic.
And what kind of records are these that are contaminated?
These are medical records of patients. These are legal medical records of patients.
And they're contaminated with sewage?
Yes.
How can they be recovered or cleaned?
They have to be freeze-dried, the ones that have been damaged, and that's going to cost the taxpayers a lot of money.
This is a repeated issue over many, many years, over the past decade.
Paul Villa, a registered nurse at Western State, filed an L&I complaint on behalf of the employees and patients potentially affected by the flooding in Building 19, which he says is not an isolated event.
We'll have leaking, we'll have sewage events, we'll have air system problems, water problems.
This is just a small part of how problems at Western State come at a high cost to taxpayers. Our investigation in September found the state has paid $62 million in injury claims since 2009 because of repeated assaults on staff by patients.
I have personally been punched in my head 15 times.
I've seen broken eye sockets, broken noses.
The Department of Social and Health Services, which oversees Western State, has admitted issues with the aging building did contribute to the hospital losing $53 million a year in federal funding.
Most of the deficiencies were all based around, or the majority were based around physical plant.
But that couldn't have been a surprise. You know they're old buildings. Why was it allowed to lapse to such an extent that that funding was lost?
The recession was a challenge on state hospitals, both on the staffing and on the physical plant. There just wasn't enough money to be able to push towards things that needed done.
After our September investigation, multiple employees reached out to KIRO 7 to share their own frustrations from inside the hospital. Not just about violence, staffing levels, or contaminated workspaces, but about a feeling that management isn't listening.
The problem is they're an echo chamber. They will not hear anything other than their own narrative.
People are starting to give up. They have no sense that there's ever going to be something given back to them.
She has worked at Western State for more than 25 years. And while she's not ready to retire, it's unlikely she'll stay at Western State much longer.
I would have loved to have stayed longer. I'm 63. And I'm sorry.
No, it's fine.
It could be a really great place for these patients. It used to be.
And we just learned about another flood in September when sewage came up through the floor in the same area. The cost for decontamination and ongoing construction is about $270,000, but the final cost won't be known until the project is finished in February. Labor and Industries says it closed the safety complaint after DSHS showed evidence it was mitigating the issue. And DSHS provided a statement saying, "We take workplace safety very seriously. We work to ensure that our staff at all of our facilities come to work in a safe and healthy workplace, and that includes environmental health. Employees at Western are encouraged, if they feel there is an environmental health concern, to bring it up to their supervisor or contact the facility's staff. Now, we couldn't interview everybody, but we do know that they are unified because the unit that works in that area with the sewage spill, they created these T-shirts and they actually wore them to hospital events.
Gosh.
You feel badly, certainly, for those employees, but the sense that that employee you talked to, her feelings for how this place could really be something effective for those who need the most help.
And everybody we've interviewed for all of these stories has said the same thing. They are there for the patients.
Yeah.
They do this very difficult job for the patients.
They felt a calling, but
Absolutely.
now obstacles. Thanks so much for looking at that, Amy.